My name is Carrie King, and today my topic is epilepsy, the effects of epilepsy, and the myths and the truths, and some basic overall facts. Just like to say epilepsy is a disorder that affects more than 3 million American people every year. My job today is to inform you the different kinds of seizures, the myths and the facts, and also living with somebody who has the disorder. I'm going to first start off by going over what is epilepsy. Epilepsy is a neurological disorder that people deal with every day. When somebody has a seizure, it is caused by an interruption of the electrical charges that normally pass through our body. This intense burst of energy causes the seizure. There are several different reasons why people get epilepsy. The first reason being is head trauma from an accident or a bad fall, infection, either having meningitis or something along the lines that cannot be cured quickly, a brain tumor, poisoning either by alcohol or drugs, or paternal injury, which is when a mother is pregnant with their child and has a bad accident. There are two main types of seizures. The first type is generalized. This affects the whole side of the brain, the entire brain. The first type of seizure is tonic-clonic seizures, otherwise known as grand mal. This type of seizure has massive jerking, tightening of the limbs, and sometimes loss of urine. The second type is absence seizures, which are called petite seizures. This is staring and loss of consciousness. The other type of seizure I'm going to talk about is partial seizures. Partial seizures only affect the one side of the brain. There are simple partial, which is uncontrolled body movements, complete partial, confusion, infantile, which is babies who have the disorder. Here are some frequently asked questions and myths about people who have epilepsy. Epilepsy affects more people in the United States than MS, muscular dystrophy, and Parkinson's disease altogether. There are approximately 50,000 deaths in the United States every year from prolonged seizure activity. There is a very strong association between epilepsy and depression. People who suffer from depression suffer more frequently from seizures. People with epilepsy do not swallow their tongue. This is a common myth that people believe. The only thing that would happen with a person who has epilepsy is they could possibly bite their tongue and possibly choke on the extra saliva or blood that is coming out. And then the other topic is people are not violent that have seizures. Ways to help somebody who is having a seizure. Stay calm. You do not want to feel panicked. The people that are getting sick will set that on you. Remove anything around the person that could potentially harm them. Try to loosen clothing if at all possible, but it's best not to touch the person at all if can be helped. Put the person on their side, so God forbid they do bite their tongue or their cheek, they are fully protected without choking. Do not put anything near the mouth area, for the person might clench down and really do some harm. If you know a person who has a seizure, do not call an ambulance right away unless it's their first seizure or no unknown history. The reason why I chose to talk about this topic is because my mom suffers with epilepsy on a daily basis. She has been having this disorder since I was a baby. It's been very scary at first when I was younger, but now that I'm older, I know exactly what to do, and it's not as scary. The best thing to do with someone with epilepsy is just take it day by day and just deal with it on a daily basis. Thank you.